Hi, everyone. For my discussion this week, I chose to focus on the relationship between chronic disease and polypharmacy. As we have learned so far in this course, chronic disease is a prominent concern in the elderly population. More than 50% of older adults have two or more chronic illnesses, which requires more complex care. Their complex care needs leads to an array of additional considerations, one of which being extensive medication administration. The elderly population tends to take multiple medications a day, which is known as polypharmacy. The World Health Organization states that polypharmacy is referred to taking 5 or more prescribed medications per day. This is especially a concern in the elderly population because they exhibit metabolic changes. That is a natural part of the aging process. Specifically, they have impaired renal and liver functions, which directly impacts drug metabolism and excretion. When elderly adults are taking multiple medications, this can lead to an array of signs and symptoms, which include tiredness, sleepiness, decreased alertness, constipation, diarrhea or incontinence, loss of appetite, confusion, falls, depression or lack of interest in usual activities, weakness, tremors, visual and auditory hallucinations, anxiety or excitability, and or dizziness. As nurses, we are going to be acting as the first line of defense for elderly patients, and in most situations, we are going to be the ones assessing and monitoring for these effects, so we have the power to catch them. If our elderly patients are presenting with any of these signs or symptoms, it's imperative that we perform a focused assessment to determine, are these symptoms coming from polypharmacy, or are they signs and symptoms of other health complications such as an infection? The article I selected to focus on this week is titled Polypharmacy in Older Adults with Hypertension, a Comprehensive Review. I picked this article because hypertension is the most frequently diagnosed chronic medical condition in adults ages 65 and up in the United States. There are also other chronic conditions that hypertension can lead to, which includes cardiovascular disease, coronary artery disease, heart failure, renal failure, stroke, and even death. Hypertension is going to be a prominent concern in all populations that we work with, but especially in the elderly because of the needs of multiple medications to manage this condition. I also decided to choose this topic because hypertension and coronary artery disease and everything is a topic that will be coming up in our next med-surg exam, so I thought it would be important to learn more about that through this week's presentation. As I was saying before, as nurses, it's our responsibility to understand the adverse effects of polypharmacy on the elderly population. This article stated specific effects that antihypertensive agents will have on the elderly population, which includes the increased risk for fall injury, hyperkalemia and hypokalemia, heart failure, and blood pressure exacerbation. Since so many older patients have hypertension, it's important that we understand the clinical manifestations that medications may present in this population, so we're fully prepared to care for them and intervene when necessary. The article also went on to discuss some of the effects, the institutional effects of polypharmacy, one of which being drug mismanagement. Because this population is taking so many drugs, it is a concern that we may improperly administer medications and give the wrong dose, give the wrong med to our patients, and that's why parameters such as using the medication scanners at different hospitals are so important to prevent those effects, because they can exacerbate drug-drug interactions, which are already exacerbated in the elderly population, and they can also lead to increased healthcare costs for the organization or facility that you are at. The researchers went on to conclude successful parameters that can be implemented to prevent mismanagement of polypharmacy in the elderly population, which includes a fixed dose combination pill, ingestible sensor systems, electronic reminder systems, medical audits, and collaborating with pharmacy throughout the medication administration process.